Poets and Quants is the leading source of information about graduate business schools in North America. Recently, they recognized Dr. Shira Brown, Deputy Chief of Emergency Medicine for South Niagara, as one of the best and brightest executive MBA grads in the world. That's right, I said in the world. Dr. Brown, congratulations on this esteemed award.
Thank you so much, Mike. I really appreciate it.
First of all, I want to get this straight here because you are a medical professional. Why do medical professionals study for an MBA?
Yeah, so a very good question. So I've been in leadership at Niagara Health for about a decade, and I wanted to really bring world-class thinking, which is already developing in our region, back to the program because I'm very dedicated to the Niagara region. So I reached out and did research and found out that IE Business School and Brown University had this incredible, innovative program that I could learn from and bring back to patient care in Niagara.
How have you applied some of the lessons you learned at Brown at Niagara Health?
Yeah, so a lot of it is around leadership in the current crisis. We did a key reflection project during our program, and actually the person who nominated me was our advisor for the program. And we interviewed 19 amazing leaderships, hospital CEOs, US representatives, actually a previous Prime Minister of Australia, to learn about the common leadership practices in crisis. And we learned that really things boil down to strategy, emotional intelligence, and communication. So that was one of the biggest learnings I had in the MBA that was really highly applicable during the pandemic and my leadership here.
Getting something else straight here, an executive MBA, most of the students in that program are people like yourselves who have a job, are working, and are looking to upgrade their skills, learn something to move to another step on the ladder. Am I right?
Yeah, no, for sure. So it does help us grow in our skills and our capabilities to be able to apply towards growing in healthcare leadership for sure. It was a highly rigorous and very intense program, and teaches you to turn around on deliverables, to think innovatively. IE Business School does a lot in the entrepreneurial space. So learning how to innovate within a corporate structure, all these things are really highly relevant to being able to progress in your career, but also ultimately, deliver better patient care.
Niagara Health is bragging about you being one of these 102, and rightfully so. How does that make you feel?
Oh no, I mean, I feel really humbled and honored. It's hard to capture all the emotions of having this sort of recognition. I'm really committed to the region. My parent has unfortunately been in the ICU in Niagara, so delivering on patient care is the most important thing to me, and I love working at Niagara. It's an incredible region.
When you look at the leadership that was needed during the pandemic, it's more important than ever to have strong leaders with a clear vision.
Yes, absolutely. And it's really also important to be sort of reliable and predictable so that you can be a stable anchor for the environment, because there's a lot of uncertainty, a lot of anxiety amongst the healthcare workers. As people remember, we had challenges with PPE at the beginning. People were nervous about, intubating. We heard terrible stories out of New York. So just being able to provide that steady hand and that anchor as a leader in a crisis is super important.
In the press release, Niagara Health touted your leadership skills as well as your service to patients, your crisis leadership, but they also mentioned research. What kind of research are you involved in?
Yeah, so our South Niagara Physician Group partnered with McMaster to create the Emergency Medicine Researchers of Niagara, and I co-chair the governance committee for that to grow research in the area.
Dr. Brown, exactly what is your team researching here in Niagara?
So a lot around qualitative research. We did some work with airways, managing airways. We've done work with operations and flow in the department. We have some with vulnerable populations and homelessness. So a lot of different projects. Actually, our group has published 14 peer-reviewed articles in the last 2 years. So it's been a vibrant group, an amazing group of people doing great work.
Dr. Brown, thank you for doing all of this great work right here in South Niagara, and congratulations once again on your award.
Thank you so much, Mike. I really appreciate it.